Great strides have been made in the fight against Alzheimer's disease in recent years, and San Diego is a hub for research pursuing the next big breakthrough. At the forefront, the Keck School of Medicine of USC's Alzheimer's Therapeutic Research Institute. ATRI is celebrating 10 years tomorrow night with a fundraiser, and to talk about the organization and its mission is Dr. Michael Rafii, the medical director at the Institute and a professor of neurology. Thanks for being with us.
My pleasure.
Let's get people familiar. First off, what is ATRI?
So ATRI is a research institute that conducts clinical trials for Alzheimer's disease, developing new treatments for that condition.
What kind of progress have you made there in recent years?
So ATRI runs studies that are both observational and interventional, and we're leading the way in developing new treatments for the prevention of Alzheimer's disease before symptoms begin.
And this institute, this is its mission. Where did this come from, and how long have you guys, 10 years now? And how did this get started?
So ATRI is an institute that's associated with USC, Keck School of Medicine. We have 8 faculty and about 200 staff, and our research mission is to develop effective therapies for Alzheimer's by testing these therapies in clinical trials across sites around the world. And so our hope is that we'll bring new diagnostics and treatments to the population.
In that line, so what are you working on now? What kind of different therapies are you developing and working on with Alzheimer's at this moment?
Right now, we are conducting a trial that uses a monoclonal antibody. It basically is the immune system to remove the amyloid plaques out of the brain. We believe that by removing the plaques early in the course of the disease, we can actually prevent people from developing symptoms of dementia in the first place. One of the major developments in the field have been the approval of 2 drugs that slow down the disease using that technology. And we're hoping that that can be used earlier in the disease course to prevent Alzheimer's disease dementia.
We're talking about it a little bit, this pathway, these monoclonal antibodies. Is this a path that you see being developed further with stronger treatments and therapies to fight Alzheimer's?
Absolutely. So currently the drugs are approved for individuals who have symptoms, and we're moving it into the asymptomatic phase. We hope that the results of our trial, the AHEAD trial, will forge the way towards prevention. But we are preparing to launch trials that not only go after amyloid, but we're also preparing to launch a trial that goes after tau, which is one of the other elements, pathological elements in Alzheimer's disease.
When we talk about what's going on right now, what we've seen, what we've learned, is it more likely that we're going to come up with therapies that stop the progress, like early diagnosis, stop the progress, or will we find a cure? Will there be a vaccine, perhaps?
Right now, the current approved treatments slow down the progression of the disease between 30 to 35%. We believe by going earlier in the course of the disease, we might be able to slow it down by 50 or 60%. And with our combination trials going after both amyloid and tau, we may be able to completely stop the disease, but we won't know the answer until we run that trial.
All right, and we have other ways people to get involved in other studies. You have the Alzheimer's Prevention Trials web study. What's that? And I think we're going to have the address on the bottom of our
So
screen.
this is a study that's online. We have about 60,000 participants already involved in the APT web study. And here you log in, you provide a little bit of information about yourself, you take a cognitive test every 3 months, and based on those results, we'll see if you're eligible for one of a myriad of clinical trials and refer you to a clinical trial site near you so you can get involved.
And that's the best way for people to be supporting your efforts right now, isn't it? Just, you need the data.
Absolutely. Without clinical trial participants, we won't be able to have new treatments for Alzheimer's disease. So we have to have this partnership in place so that we can get new treatments.
One thing just to touch on, you're this entity here in San Diego, but is this a collaborative effort with other labs? How much information do you share with people around the world?
ATRI is a coordinating center for the NIH Alzheimer's Clinical Trial Consortium, and we have partners at over 150 institutions around the world that we work with and collect the same data in our efforts to hopefully one day cure Alzheimer's disease.
Let's just end on that. How far out do you think we are until we get at least a therapy, a combination of therapies that basically stop it in its tracks?
I'm hopeful that in the next 5 to 10 years, we will have treatments that will be prescribed to individuals who have a high risk of developing Alzheimer's disease to prevent the development of any symptoms in the first place.
From no therapies at all that offered any kind of real impact to possibly that in 15 years. Amazing stuff. Dr. Michael Rafii, thank you so much, and thank you for what you do at ATRI. I'll be at the fundraiser. I'll see you there. I'm MC. I'm helping out, and I'm looking forward to it.
Thank you so much.
Thanks.